one. I like to use an old one, which they don't have these anymore because they're not safe, right? You can use a sticky if you wish. Now, when a person comes back after, remember I told you the story about the president of the college wanted to watch me in clinical and whatever, and we brought him in a room. I don't even know if Marsha heard this. And the patient was bleeding. A mess. Getting blood, screaming in pain, where, it was a mess. And this was bleeding profusely. So I said to him, "Are you sure you want to go in there?" And he said, "Yes, I do." He got a little white. We had to wait out here. But sometimes these really bleed initially, so you put a pressure dressing on. They're not going to do this for you, but can you hold him up, somebody? Okay. All right. So when you do, like, let's say I've had my fingers amputated, or I need one on my head. Old Dr. Vayu, God love him, every time I think of this, showed me this. See, what you want to do is go over this way. You see that? Okay. So you go back and forth over the round. Okay. You want to get all the ends in, right? And you put a little pressure on it over the dressing to stop the bleeding. Okay? So really, the three big wraps I've done in my 40 years of nursing are ankles, right? Sometimes you can do a wrap over a knee to keep a dressing on. Again, check CSM because it's elastic. So you can practice this here at this particular station.